Welcome to AI Wellness, and we're here at the World Cup Fan Fest and have tons of amazing therapies for people to come out here and try out. But today we're going to talk about a pretty awesome topic, and we're talking about medicine in a totally new way with prevention, longevity, and precision. And on this panel here, we have three amazing doctors. We have Dr. Gideon, we have Dr. Sharon, Dr. Rife here, and each one of them have amazing specialties and backgrounds. And so today we're going to start here with Dr. Gideon and get into the longevity space. You know, the first time I came down to AI Wellness Clinic to see the clinic, I was like, this is my space here. And you don't see as many, medical doctors and osteopath here yet, and you're seeing more and more move that way. And so when I came down here, I'm like, oh, this is a medical clinic, and they are doing the cutting edge, cool stuff. Yeah. And so from a longevity perspective, I know we talk a lot about a lot of different things, but in the past we've mentioned, talk about mitochondria, right?
Yep.
And so let's dig into that. Why is that so important?
I think, when you look at the longevity space, and, I'm dabbling in it. My background's aesthetic medicine, so I've played in that world for 20 years. But longevity has always been a part of my world because patients always want to get better. Their face looks better, now they need the body looking better. And so, as I've been delving into what is important, I think, questions you always get is if I had to change one thing,
right,
what would I do? I think it's something that has to do with mitochondria health is one of the biggest primary things because it affects the energy stores. We talk about PEMF. What is that? It's electrical, it's electric things that are going in our body. Our heart runs on electricity. All of that, when you talk about electricity, what drives electricity? You need a source. It's ATP, and mitochondria support the ATP. And I think as we realize our mitochondria, that whole pathway, there's a lot of things that can dysfunction, cofactors that get missing, just differences in free radicals and attacking the system. And so your whole system becomes a lot less effective and a lot less efficient, so that one glucose molecule is not producing 36 ATP anymore, it's producing 20 ATP. So your reserves start to get less and less and less, and that actually is why our actual body breaks down. You don't have the resources to actually heal itself, because if you did, the body actually would heal. In your 20s, you cut yourself, boom, you're healing. You twist an ankle, you're all good the next day. Why is that? Because the body actually has the resources to put into the healing.
So explain that, because every time I say it, we talk about mitochondria health, and everybody hears that buzzword. Yes. But the one thing most people ask is like, Doc, what is about mitochondria? But what is it?
What is it?
If you give us like the 8th grade answer, what
the 8th grade answer is it's an organelle inside an actual cell, and they can have one mitochondria. Heart cells have a lot of mitochondria to power that. They are these little organelles that take the glucose and have all of these metabolic pathways that produce ATP,
which is energy.
ATP is energy. That's the cash flow.
You're doing exactly how I explained it. You're doing this. I go, to even do this, you need ATP.
You do.
You need ATP to do anything
just
at all.
Just to function, you have to have ATP.
So how important is ATP when we're talking about neurologic health and longevity when it comes to brain health?
Oh my God, it's so important. I mean, anything that has to do with repair, anything that has to do with function, breathing, all of those pathways, just metabolism itself requires ATP as part of that. Yeah. And so if you don't have ATP, you really are not going to function. This is why at the end of life, you start to get slower. You don't have the energy. You repair slower. Everything has to do with the reserves. You start as a kid with $10 billion worth of cash in your reserves, and by the time you're 80 years old, you have $1,000 left. Well, you can't do very much with the 1,000 compared to that 10 billion you started off with. And so really, I think wellness is starting to understand that. Now, there are things like putting the body in parasympathetic, which I think is a very important second thing, because if your body's constantly in the state of like fight or flight, you're utilizing your resources too quickly, and you're not actually able to put the utilization of your resources into actually repairing the body. And it's only when you are in parasympathetic that you're actually going to repair. So there's a whole pathway, and I think the wellness world is coming together slowly. It's all over the place. Like medicine, unfortunately, it takes the ecosystem of medicine is like it's systemized into individual things, and not realizing that medicine actually, as an osteopath, should be a whole system ecosystem.
Whole body.
Your whole body. Your heart affects your kidneys, which affects the gut, which affects the brain. I mean, people are starting to realize gut-brain axis, you know, and so I think the door is starting to open, and people are starting to go back to, okay, how am I going to take my health into my own hands? Because the doctor literally is seeing me for my blood pressure, which could be affected by your gut health because your nitric oxide production is so low because you're using fluoride to kill off all of. I mean, there's so much to what we are doing to destroy our body that we don't realize it. And so it is unfortunately hard because the wellness world is individualized, and we need to get it together, and that's what AI Wellness is here to do, is bridge that gap, provide the education, and hopefully the wellness world starts to come together to work on stacking it, to not be individualized. It's only my red light therapy, and that's the hard part in this industry. You get these companies like, oh, why are you carrying only my red light therapy? Well, that red light therapy may work great for that aspect of it. This one has yellow and blue and stuff. They work in different aspects of it.
They do totally
need
different
it
things.
all, yes. And so I think, you know, it's business, it's capitalism. We'll find a balance, but medicine needs to work together for the benefit of the health, and it's about prevention. I tell patients in my field, start earlier. Just because you don't feel anything doesn't mean things are not breaking down. You know, the body will repair itself up to somewhere about 70%, 75%, and then it drops off a cliff. It's kind of like your car. It's running great, and you didn't do any maintenance. Well, sooner or later, one day, you're going to drive out, and smoke's going to come out. It's going to make a loud noise, and it'll stop in the middle of the freeway, and you're like, what the hell? Why? It was just driving well yesterday. Yeah, well, you didn't do any maintenance on the car since you got it. Well, what do you think you're doing to your body? You're lucky your body can repair itself up to a certain point,
Or
and
you
will
would,
fight.
or you would have crashed a long
or
time
you would have
ago.
crashed a long time ago. Your 20s would have destroyed you.
Right? Well, the thing about, and here's the thing, so as a functional medicine doctor, we're always looking at root cause, right? It's just like, oh, you have a thyroid issue, and that's kind of what I did, and so it's like, well, I'm not just looking at the thyroid, I'm also looking at your iodine deficient. I'm trying to get down to the basics, right? But the basics for everything, regardless of what issue you're dealing with, is mitochondria, because you have to have the energy for your liver or your thyroid or your gallbladder or whatever it is, whatever pathway. If you don't have, it's like your car. I got a chip in the window, and I'm trying to be preventative, so I'm going to go get that chip filled, and I run out of gas on the way to get the chip filled, and you're like, what happened? Well, mitochondria. There's no more mitochondria. You know what I mean? And so, so important. I know it's a big word, and some people. But it's that simple. It's your energy stores, and you have to start with that. If you don't start with mitochondria, all the other stuff you do is almost irrelevant.
It really is true. So
Well,
get your son.
There you go.
Get your son. Red light therapy, NAD, all of it helps. And so, you know, repairing that system is going to be the biggest thing, I think, as the first step.
Awesome. Well, thank you, Doc. Well, now we're going to move on over here to Dr. Sharon, and the special one here is that she specializes in women's health. You work at the VA as well, right?
Yes, I do.
Well, I'm going to do this here. I'm actually a disabled vet, so I love that people that are into working and helping with these former military people, because I don't know if you realize, but it is a big thing, and it's a great thing that you're doing. And you know, for anybody that knows, you're not necessarily the doctor that's getting paid the bazillion dollars to go work with the veterans. You know, you're doing it because you have a big heart, and so. I want to know, especially women, because I have a women's health podcast, and we specifically talk about, you know, it's geared for women 35 and above. And the number one question or number one thing is they always say, well, I went into my doc and I told him I'm not feeling good, I can't sleep, I'm night sweats, I have no energy. And they're like, oh, that's normal. You're going into menopause. That's just how it is. And
suck it up.
Suck it up. And I'm going to tell you right now, if that is the doctor you went into, go find a new doctor, because they are incorrect. Because you can be in your 40s and your 50s and your 60s and have energy and feel good and be able to sleep and not sweat through the night and not have a hard time falling asleep. So how often do you hear that?
Well, that particular question, practically every day, multiple times a day, we hear about women's health, women postmenopausal symptoms, perimenopausal symptoms. You know, we focus a lot on prevention. right? And that's the key. So we want to prevent. We all want
Well,
the.
let's start there, actually.
Okay.
What are some of the things you do for prevention? Let's start with there, because I know what you're going to say at the end, because
Yes.
I think everybody on this panel is like excited about that. But let's start from the basics.
Right.
Prevention. What do you recommend?
So we need to know like where we are when we're starting this process. So first thing you need to do is your baseline. So we work collaboratively with quantum labs. We want to check what our hormone levels are. We want to see where we are, because we do have a variability. Every woman is individual and is different, and we really cater to like the uniqueness of these hormone levels for women. And women have different symptoms. So it's not just the hot flashes that we all hear about, night sweats, and because we have depression, we have insomnia, we have moodiness, we have weight issues, brain fog. That's another big one that I hear all the time, right?
That is a really big one.
Yes. So there's a multitude of symptoms that women will experience in this kind of perimenopausal age. So when we start early, we can actually prevent the outcomes that we're all hearing about, and that's the key. So we really focus on the prevention so that we do have that longevity, and by doing that, we incorporate a very precise treatment plan for our women, so that way they can really cater to their specific hormone deficiencies.
So, and I love that, because this is the doctor of the future, which is we've talked about in the past, is also the doctor of the past. The doctor 150 years ago was the doctor that looked at you and said, yes, I have 10 women today in my clinic that all have hormone issues. They're all in their mid-40s, early 50s, but they all have a very different treatment plan.
Yes.
That is a doctor of the future, is like taking that individualized approach and not just putting all of them on the same protocol, because as you know, although they have very similar labs and they may have some similar symptoms, everybody's body, everybody's terrain is different. And so what is the next step you go then from prevention? Then where do you go?
So then we have the bioidentical hormones. That's kind of the buzzword that we've all heard about. But it's to make sure that we're not trying to be cookie cutter.
Right.
Providers. We're really trying to individualize the approach to treating our patients and our females in particular. So that's one of the keys for longevity.
With that, one of the questions I get a lot from women, because they've heard, especially women. Men don't care. Men are like, just stick it in me. I'm gonna feel better. I don't need to know what's.
Yes.
You want to read this first? No, I'm good. I skimmed it.
Yes.
Women are like, they need to know, right? But a lot of women I've also had come back and go, they've been real scared about getting bioidenticals because they've heard this or that. But if I recall correctly, the FDA has come out here just recently, I think this year, and has removed some of these old black box warnings. Can you speak on that? Because the one thing I found that prevents women from even wanting to try it, bioidenticals, is the misinformation. Yeah.
Absolutely.
And some of that, and much of that misinformation has come from the FDA, which they corrected course this year. Can you speak on that?
So if we go back to the 80s and the Women's Health Initiative, back in, started in Massachusetts, so there was a long-term clinical trials. So we always want to base, these FDA decisions are based on clinical trials, but unfortunately you need to know the population that you're treating, and in that particular study they were testing women in their 60s for it. So of course when you're in that age range, you are already going to have a higher probability of having cardiovascular disease, of having breast cancer, stroke, just due to the age factor. So there's a skew of that population, exactly. Yeah. And so the data that was interpreted from that was based on a cohort that we don't usually see as starting to have these perimenopausal and postmenopausal symptoms.
That's just, when was the last time you had a 60-year-old woman come in your office, wanting to start working on her hormones?
Exactly.
Right. So,
exactly.
So the cohort to begin with was the wrong cohort, wrong cohort. But so now let's get to the end part, and then we move on to Dr. Reif over here. What should a woman or a man, male, both that goes on bioidenticals, what are they going to feel? How are they going to feel, and how quickly are they going to feel that way?
So again, when we're screening, we're doing prevention. As long as you've met all your primary prevention, mammograms, cervical cancer screenings, there really aren't that many contraindications to worry about, and you can literally have results, within a few days. So it doesn't take years or months, but it is a lifetime change. So that's the key. So you might feel good early on, but it needs to be consistent, and as we do, kind of the whole body. So we're not just treating one particular part. So not just the hormones. We need to incorporate many other facets of your health in order to keep that longevity going.
So what I've found with women that have gone into bioidenticals and they've done these like 2 things, where they've started doing strength training exercise. So they're using actual weights.
Yes.
And changing their diet and greatly increasing the amount of protein.
Yes.
You pair those 2 things with bioidenticals, and oh my gosh, I have a business partner who is in her mid-50s, late 50s, and her energy, oh my gosh, man, I'm like, you are just off the walls energy.
Yes,
and 6 years ago, she felt miserable. And so, well, thanks for sharing that and sharing these nuggets, because there are a lot of people that have, women especially, that have some of these questions. So I think it's going to be very helpful. So
appreciate that.
All right, now coming down here, this is the, I think what Dr. Reif does and what he represents is this is really some of the future of medicine.
We are the future.
And there's, if I were to say a few things, when you start thinking future medicine, you think peptides, you think exosomes.
Absolutely.
And so,
absolutely.
What do you guys do?
Well, I love the mitochondria. That's the mainstay. But what we forget about is inflammation. Inflammation is the killer. We don't know it, and we think inflammation. Oh, I bang my knee and it's swollen. No. We're talking your organs. We're talking everything. Your brain. Everything becomes inflamed. Without mitochondria helping that ATP push that inflammation around, we're nothing. I went to a lecture a long time ago. Sanjay Gupta, if we all know, he did this lecture. It was called The Color Purple, and he talks about how mainstay medicine treats everybody as navy. On the spectrum, purple and navy are side by side.
Yeah.
And that one purple patient passes away because they missed something. Dr. Kwok, Dr. Sharon, they don't let purple get by. Quantum does not let purple get by. Exosomes does not let purple get by. Okay?
So let's get into that, because that's a big word. A lot of people have heard this word, exosomes, right? And as doctors, we often talk about mitochondria and exosomes, all these things, and we just say it and we rattle and we keep moving, and people like nod their heads and they're like, what the heck does that mean? What are exosomes?
Exosomes.
Let's start with that.
Okay, so exosomes are produced from stem cells. Everybody knows what a stem cell is. You hear about stem cell. The difference is exosomes don't regenerate. They go in and they do their job. They find what area needs to be repaired or helped or move along, feeding mitochondria, helping that, along with peptides, getting in there and making that cell just super healthy. Exosomes find what's the ailment is. It's the engine is a perfect example, because if you take a look at someone who didn't put oil in and you take those headers off, and all you see is particles, and those are dead cells that are sitting in our body. We get in there, we need to break those up. We need to make sure that we're getting new cells, new blood flow, pushing out the inflammation. Exosomes are they're virginal cells. They don't know what they are until they get in there and they say, oh wow, I can help you here, I can help you here, I can help you here. And by doing so, it helps to repair, bringing that anti-aging down. This is the future of anti-aging. As we do more and more research, more white papers and more studies, we find different areas that helps with the exosomes. But without having that information beforehand, you're shooting darts in the dark.
Yeah. Well, and this is the nice thing too about exosomes, and you get a lot of longevity. When you're dealing with longevity, and if you ever come into the AI Wellness Clinic here in Beverly Hills, like you'll be absolutely amazed, because it is literally like walking through a biohacking clinic that has every cool longevity thing you can think of. Some with, there's some things that have tons of research, some that has newer research. Exosomes, a lot of research, right? Can we go into kind of the research and how long they've been doing the research?
A lot of research. Exosomes have been around for a long time. I think doctors are afraid of them. What I see when I'm out there promoting, they don't know enough. We're not educating enough.
Yeah.
I think we should be educating more, because in the future, the exosomes, there's going to be just a clinic where Dr. Kwok, Dr. Jamie sends me over a patient and says, here we go. We did this, this, and this, and we did exosomes. What else do they need? And we're doing nasal spray now for people who don't tolerate injections. We do joint injections. We do IV injections. IV is a full system flush.
Yeah, okay, so let me pause you here, because that is a big one, and then we'll probably wrap up after this. Because a lot of people have heard about the injections directly into the joint when there's an issue, right? And then now we're hearing stuff like where now you just hook up to an IV and you put the stem cells directly in. And I want to hear this from you, because what I've heard personally, and I'll just throw it out there, and I'd love to hear your take on it, is that the IV actually now is that the better, is that like the most not better, the most robust route?
It's a shotgun approach.
Okay.
When you're doing the injections, you're not just doing joint injections. Now they're doing interosseous injections and basically building up the cartilage from the inside out. Instead of just trying to fill that void and you lose exosomes. When you go interosseous, you go right into the joint. You go right into the bone. There's several different.
That's what people they heard about. You get injection, but then it wasn't working.
No.
So now, because what they're changing how they're doing that, that makes way more sense if you're going interosseous to really rebuild that cartilage.
I think it goes back to education. If you have a meniscus that's just flapping around, and you're going to do an exosome, it's not going to grab it and suture it up and make it better. It's going to reduce the inflammation in hopes that the meniscus will start repairing upward. If you do the interosseous, you're going from the bone out. You're building kind of like a coral reef.
Right.
Right? And that cartilage starts to regenerate. But for the rest of the body, the heart, there's doctors that are reversing, certain things, certain disorders, and we don't know about it. We got to get doctors out there starting doing papers. We have to do more research. We need to have the backing of great doctors like this. We need quantums, labs. We need everything to support us. And we're ready. We are top lab in the United States, and our counts are amazing. And I'm happy. This is the greatest thing I've ever done in my life.
Well, you're definitely part of the future of medicine with exosomes. I know there are a lot of doctors out there that are using exosomes and having phenomenal results. But unfortunately, in this space of when you're becoming trying to be on the cutting edge, you sometimes also as a doctor might feel like you could potentially be a target.
Yeah.
And so I think that's what's probably prevented some doctors from coming out with a lot of these case studies that they have. But at the end of the day, case study is case study. If you've got a patient, you've got before and after, and we get more and more practitioners coming out providing this information in conferences and seminars and educating others, and not just relying on these huge studies, I think it'll grow faster. And so I tell you what, if you want to experience some of the most amazing techniques, some of the most amazing equipment, from lasers to face regeneration, rejuvenation, you name it, it's all here at AI Wellness. And like Dr. Gideon said before, you got a laser here and a laser here. Not all laser red light therapy is the same, because you have different colors, you have different frequency ranges, and the frequency ranges really the colors are less significant. That's more of an LED light. It's the frequency that's behind that is really what's doing it. So whenever you're going to go look at something like that, make sure you're doing your research and you're finding a clinic that has doctors that are just on the cutting edge of it. They're just not something they're just adding to their clinic. You want to get with docs like this that are really spending their careers at trying to make medicine better for everyone. So thanks for being with us today, guys. Great conversation.
All right.